Okay, so we're going to be doing a McMurrays test today, which is testing the lateral and medial meniscus of the knee. So what sport are you playing?
Baseball.
Baseball. Okay, and what position do you play?
Back catcher.
Back catcher. Okay. So we're going to be testing his, which knee is it?
The right knee.
The right knee. Okay, so we're going to be testing his right knee. I'm going to be doing this. I'm going to be bringing you up into full hip flexion, full hip and knee extension. Just trying to test out the meniscus to see if we can find out if it's the lateral or medial meniscus, or just rule out a meniscal issue at all. Okay? Is that okay? Do I have your permission?
Yeah.
Okay. So what we're going to do, we're going to bring his leg up. I'm going to be palpating the tibial tuberosity going up into the patellar tendon, and then coming lateral and medial of that, trying to find that joint line. And a little bit inside the joint line and a little bit inferior should be those meniscus. So with my hand just there, this hand is feeling for any crepitus, any popping, any snapping. And if there's any popping or snapping underneath the patella, we're not so much worried about that right now. We're just trying to test out that meniscus. So I'm going to put his tibia into external rotation, which is going to be testing the medial meniscus. I'm coming up into full flexion. Is that okay there?
Yep.
Okay. And now I'm just going to come out into full extension. Painful there?
Yep.
Okay, and I heard a little bit of snapping underneath my fingers, so that is a positive medial meniscus McMurrays test. If there was no pain or crepitus, then that would be a negative. So now I'm going to be doing the same thing, except for this time the tibia is going into internal rotation, which is testing the lateral meniscus. So again, finding that joint line, coming into full flexion, and down into full extension. That's okay?
Yeah.
Okay. So I felt a little bit of crepitus, but not as much as the medial side. I would say that was a positive test as well. If it was negative, there would be no pain and no crepitus within the joint.